Our children are born into the world of our future. The supercomputers of yesterday now fit into our pockets. Our cars drive themselves. Tourists go to space. Our medicine is the most advanced it's ever been. But not if you're pregnant. Think of all the potential complications during and after pregnancy. How many drugs do you think we have developed specifically for pregnant women? It must be in the thousands, right? Well, the answer is 2. Only 2 drugs. Ever. And the last one was first registered in the 90s. No breakthroughs in therapeutic treatments to help pregnant women and their babies since. But it isn't just that new drugs haven't been developed. Women often don't have enough information about whether a treatment is safe or not during pregnancy. Take the COVID-19 vaccine, for example. Some women are still unsure whether they can take the vaccine before, during, or after pregnancy, leaving them more vulnerable to serious infection and death. This is all because pregnant women are routinely excluded from clinical trials. Not many people know this, or that there's only been 2 drugs ever. So what do women think?
2? Only 2 drugs?
Wow, 2. That's extremely shocking.
I would have expected a lot more drugs and a lot more advancement.
All the complications I've had with my pregnancy, and I suffered quite a lot with not being able to take medications.
One of my closest friends actually died a couple of days after having her baby last year. So it's the most painful thing in the world. And every time I see her daughter, it breaks my heart.
Why are there not drugs out there invented to cure pregnancy-related complications like pre-eclampsia?
These women have questions. We put them to Professor Kathy Nelson-Piercy.
What is a clinical trial exactly? What does it entail for pregnant women?
You may be asked to take part in a clinical trial where you may or may not receive what's called the active drug. Usually 50% chance will receive a dummy drug, a placebo. That's what we call a randomized clinical trial. So to come into the trial, the researchers have to be happy that it's not dangerous for you to get one or the other. And you have to be happy with the chance that you might get the active treatment or the dummy treatment.
Why are drugs not being clinically trialed?
I think because it's not attractive to drug companies to develop those drugs in the first place. It's harder for them to get those what are called phase 3 trials to try out the drug in humans after trying it out in animals, insured, because it involves pregnant women.
So how do we fix this problem?
People think that pregnant women won't want to be part of studies, but they will. And I have so many of my patients who say, let me help. I want to take part in any research. I want to make it better for people who come after me. Getting the drug companies and the ethics committees and the research funding bodies, getting them on board and understanding that actually pregnant women want to help.
This situation is simply not good enough, and we can no longer be excluded. Pregnant women need help. Share this video and start the conversation with the hashtag #OnlyTwoDrugsEver.